Hello and welcome to Bump Love. Have you subscribed to our YouTube channel? If you haven't, please pause, go subscribe, and remember to like, comment, and share this episode. We are talking endometriosis. It's a condition that is not openly talked about nowadays, and yet it greatly affects the reproductive health of the sufferer. Our guest today was diagnosed with stage 4 endometriosis, and today she shares with us how this condition has affected her life. Welcome to the show, Sheila.
Thank you, Rachel.
Sheila is a community psychologist by training, but she's a teacher by passion. Yeah. Welcome to the show, and we want to hear your story, and we'll start at the beginning. What is endometriosis? I know it's a term that is thrown around as women when you visit your gynecologist or in reading about fertility and all of that, but we want to try and understand what it is and how this condition presented itself before you had to go see a doctor.
Okay. Thank you very much, Rachel. Thank you, Bump for having me and for the opportunity to talk about endometriosis.
Yes.
Thank you for allowing to share your story.
Yeah.
So you asked what's endometriosis. Endometriosis is a condition where the tissue that's similar to the inner lining of the uterus, which is called the endometrium, sheds every month, as happens with menstruation, but outside the uterus. So you menstruate normally, but you're also bleeding elsewhere. So you're bleeding in your pelvic cavity, and there is no exit point for that blood.
What?
Yeah, that's
I was
what
going to ask
endometriosis is.
whether the blood joins
like
the
where
one
does
for
the blood
the
go?
menses.
There's no exit point, and that's part of the problem.
Yeah. Okay, so it sort of stays within
The pelvic cavity. So what the body does, it tries to wash it, clean it out. Yeah, so of course, because it's foreign blood there's inflammation, that's the pain you get.
Yeah.
So I think that's how the body is. It will try and wash it out, but over time there's built up.
Yeah.
And hence the problems for people who happen to have endometriosis. Yeah.
So in your case, how did it present itself? What were the
Yeah, what were the signs? What were
signs or
what
symptoms?
made you even go to the doctor?
Yes.
So I'd always had painful periods. I started my period when I was almost 14. I was 13. It was the third term of my S1. So I was almost 14. So my first experience was a painful period. That's all I knew.
Oh no.
So I'd go get medication, painkillers. At school, actually. That's where I was when I started my period. So I was on pain meds. So you take all kinds of painkillers. Over time, that's your experience. So some girls have painful periods, others don't. But over time, it gets worse. So for me, throughout secondary school, I was on painkillers. Sometimes you'd miss class, maybe the first day of the period, because it was quite painful. And then, of course, you always had your hot water bottle. And then uni, the same story at university. But I think when I was 30, the first time, so sometimes I'd actually just go to the clinic and say, give me an IV. I want this painkiller.
Oh no.
You know, when I want it. So, but they would always tell you, have your periods always been painful? So that's the norm. There was no further questioning. So when I was 30, I went again to a doctor. And then, of course, I gave him my menstrual history. And he told me, you know what, let's do a what? No, let's do an ultrasound. So
that's the next
So the test, you're right. So I did the ultrasound, and then they saw I had fibroids. So they were very small fibroids. That's when I was 30. And so he said, you know what, these fibroids are too small. I don't think they're the cause of your endo. I don't think there's a secondary reason. I think just keep taking painkillers.
Wow.
So I was like, okay. But I was like, but there's something up. I don't think that's normal, So,
Life went on.
Life went on because I was told there's no other reason, And I'd actually read about endo, but the way it was described,
You didn't think.
it just seemed so bad. Like in your head, this is kind of normal.
Yeah.
So when you read about it, it's kind of removed from your experience.
Yeah.
Anyway, but 2020 during COVID, I had really bad periods. I was at my mom's and I just couldn't sit even upright. So I was 37 then. Just at that time, 37.
I know, you know when you reach your 30s, yes. You're like, am I 36? Am I 36?
I'm actually 37 now for sure. So 2 years ago then maybe I was in 37. I was 35. Yes, I was 35. I had very painful periods. So I asked friends of mine to pick me from from my mom's and we went to the clinic. And so they, again, same story. I did an ultrasound. The doctor was like, these are fibroids. Okay, you're 35, you're getting older, you should get pregnant. That's
the solution, yes.
I was like, how about if I first establish what's actually wrong?
Happening, yeah.
I was like, I see fibroids. I was like, I don't think that's what's up. And then he told me he prescribed pill plan, a contraceptive, yeah? So I told me take it for 3 months. I was like, you know what, I don't think I can do 3 months. Let me start with 1 month as I try and investigate a bit further. So I came back to Kampala. Mom lives in Wakiso. So
hold on, they gave you a contraceptive to fix the problem?
Yes, I think they thought it was a solution because what a contraceptive does also, it suppresses some hormones, yeah? So it actually does, it treats the symptom, but we didn't really know what the problem was. Yeah, so I think he actually thought it was the fibroids causing the pain, and fibroids also can cause bad period pain when they get bad, So when I got my ultrasound, I sent it to a friend, a doctor friend of mine, a radiologist, and he told me, you know what, just come and see a guy I know who's good at Rubies. So I went and I saw this guy. He just sat me down, and he's the first doctor I felt actually listened to me. He's like, describe your symptoms. He just listened, and then he said, what you're describing sounds like endometriosis. And when he said that, I was like, this is it.
It makes sense. Were your periods regular?
I know very regular.
Oh, that's
on the
so
clock.
painful.
You know?
I don't know if it was painful, but for me, I think that was normal. So that's I'll deal with that.
And that's the thing about period pains. Like you can't tell someone you hurt more. Like you can't compare the pain.
No,
you know, like you can't. All of you are in pain, so you all think that it's the same degree of pain. And wow.
Or even if you think you're in more pain, you're like, that's my cup of suffering.
Yes.
So like some people have worse periods than others. That's what it is.
Yeah.
True.
So that's how I end up being. Also, when I saw him and said, I think that's endometriosis, I was like, okay, so what's the sure way of knowing? He said you'd have to do a laparoscopy, which is keyhole surgery. Just put a camera in there and find out. I was like, okay, let me think about it. So I did 2 weeks.
So when you say a keyhole, you know you're passing.
Yeah, passing
the things quickly on her tongue. So just explain the keyhole surgery. So they're getting a camera, putting it up your,
No.
No?
Yeah. Yes. So
through your navel.
What
through your navel.
Yes.
Did you see where I was going?
That would be a transvaginal ultrasound.
Transvaginal ultrasound, yes.
Oh, not a keyhole.
Yeah. Some people actually use that to diagnose.
Okay.
But I didn't have that done.
Okay.
Yeah.
Okay.
So what happens, because it's in the pelvic cavity, that's where all these organs are.
Yeah.
So they put a camera through your navel. So they make one an incision, and then also in the navel to blow up the abdomen to see. Yeah, and then I asked for a video of the process, and also
So you were under a general anesthesia.
Yes.
Okay.
So usually when you hear the word stage 4,
sounds like
you know, like you're just like,
what's happening?
like it's always because you're like, when did I pass stage 1,
stage
2,
3
to now reach 4, and also where is the maximum?
Yes.
Is it 6? Is it 10? You know, so at that point when you're being told that this is stage 4, what's first of all, what does that mean in real terms? But then what did it mean to you?
To you.
Actually, wasn't told that it was stage 4 at diagnosis. I think my doctor didn't, I don't know, to scare me, or I don't know why they, I think they do it maybe not to scare you. But for me, I got reading and seeing symptoms, and eventually then I asked, but what's the stage? And then I was told, but what's stage 4? So endo is categorized in 4 stages. And it's about the location where the endometriosis is found, the depth of the endometriosis, and on which organs it is. Yeah. So stage 1, you have the endometriosis lesions, but they are...
Lesions would be, in simple terms?
Lesions would be like, I don't know what to call them, like wounds.
Like wounds,
on your skin, but now it's on your... on your like peritoneum, the lining of the abdominal wall. Okay. So it's how far in they sink. So the further in and on which organs they are.
Yeah.
So stage 1, they are still like on the surface. So stage 2, I think a little more spread, but still not further in. It's stage 3 that you probably have cysts on your ovaries. I had cysts on my ovaries. So some will just call it ovarian endometriosis, and they call these chocolate cysts.
Chocolate
And because they have blood in them. So they're not your typical cysts that's probably colorless, but they have blood in them, so they call them chocolate cysts, ovarian cysts. So those are clear symptom of endometriosis, usually stage 3. And then stage 4 is you will have that, but then you'll also have this. It means that they have now the endometriosis has penetrated a bit deeper. So you might find it like in my case, some of your organs attach. Yes, like glue. So there are also there are lesions, which are the endo, the wounds. But then there's also adhesions. Now you get, which is like glue, adhesive
Like
adhesions,
this
like glue.
lesion and this lesion
So
come
over
together.
time, there is scarring, and the organs begin to attach. Like in my case, my bladder was attached to my uterus at the front. This is the back. So it twists the anatomy of your pelvis. So it was stage 4. So your organs have started to attach. And then you also have the endometriomas for sure. So that's the last, like the
last stage.
So even in stage 4, there are those who have what they call the frozen pelvis. It's sometimes also those organs can attach to a bone, or if it's so it's like ideally the organs should be free flowing in the pelvic cavity. So that's what they call deep infiltrating endometriosis. That's it. Usually stage 4 when it's really gone deep in.
Of course, I feel like a chill right now, just hearing this information, and literally scared, because now you're thinking of more things, like now with children, like will I be able to have children? Will I be able to live a normal life? Does this get treated? Can the organs be like what? I want to know what you were thinking and feeling when you found out what's actually happening with your body.
I think the first thing I felt was relief.
Oh yes,
it was like, okay, at least now this is a problem. At least there's a problem now. We can start looking for the solution. So there was relief, obviously. But part of me was also angry. I'm like, how could they just not say it? So then, of course, I was like, okay, what's endometriosis? What really is this thing? So I just became curious. I was like, let me find out for myself. So I got reading. The more I read, I was terrified, honestly, when I read. But I'm curious. I want to know what I'm dealing with. So I got some books, Beating Endo, The Daughter Will See You Now. Which other book did I get? Ask me about my uterus. I've got a couple of books just to educate myself. And it was terrifying, but then I realized it was a worldwide problem. Like generally, it's not taught in medical school. People have no idea. I'm talking about the medical world. First, gyns don't have an idea. Because there's only one guy who actually said that sounds like endo. And he's a much younger guy. I'm actually older than him. So I realized that it's a problem. It's just not, it's a thing that is not taught. They've not given it attention, and yet it's chronic. The statistics say 1 in 10 women. Others say 1 in 9 women suffer from endometriosis. So its incidence is as high as diabetes, asthma.
What?
So I was feeling a bit angry when I was reading about this. I was like, okay, this is actually quite sexist. Like medicine can be sexist because it's a woman's problem. But no one talks about periods, just periods. How are they going to talk about endo? So there's kind of maybe shame attached to it and stigma. So it's like, no, we should talk about this because it's a very natural, menstruation is natural. So women shouldn't suffer like this. So I was angry, but I was first relieved because now I knew what I was dealing with and at least I could find solutions to it.
So Sheila, how has endo affected you as an individual?
It's affected me physically.
The pain.
There's the monthly pain that got worse over time. Real pain, like you get, if anyone has had menstrual cramps, you get leg pain, okay, maybe not the same, but leg pain, back pain. Then, I mean, by the beginning of this last year, I used to just get pain any time of the month. Now, it didn't have to be around your period. You get shoulder pain. I became anemic, so I'm still on iron. folic acid and all.
Yeah.
Yeah, physically, yeah, like your health, it definitely affected my health physically. And most recently, when I had surgery, I had to have 2 surgeries. The diagnostic one in 2020,
Okay.
and then the one I had more recently in July. I actually had to have my fallopian tubes taken out because they were badly damaged. So yeah, that's how much, that's physically, yeah. Then emotionally, my gosh. First of all, this whole time you're like, but this pain, it doesn't make sense, you know? It gets worse over time, it affects your work. You can't go, now you make a lot of your programs around your menstrual cycle, you know? You cancel plans by maybe, I mean, we're in COVID when I found out, but when things are picking up, you begin to cancel a lot of plans. You make plans with people, and then because you're fine now, 1 second you may not be fine and don't have to be on your period. Because before, you're making your plans around your period, but now the pain is just anytime, yeah. So it's really chronic pain, and you just cancel. So you become that person. You're like, but when did I become this person who can't keep my word? People don't understand. You tell them, man, I'm just sorry. Someone could have seen you just last evening, and then you're telling them today.
You're not fine.
Exactly. Yeah, so it affects your social life as well. So those who get it, those who know, you'll be like, okay, she's not well. But it affects, you can't do certain things, you know?
Yeah.
I'm quite active, so I really slowed down. Like, I don't do as much sports. I mean, a part of me is fearful. I'll be like, you know what, I have this problem. Let me not go looking for other problems.
Yeah.
So you do the simple things, maybe swim, walk. I haven't done a marathon in a while, and these are things I used to like doing. I used to go hiking. I haven't hiked in a while. So you're kind of fearful,
Yeah.
So that affects your social life, but also your physical activity, and then mentally also, because you're trying to figure out what's this thing, you know? Was I making much of it?
Yeah.
Did I have chejo? You know, but now that you know, okay, I'm not alone. So this actually is a thing, but how do I cope? How do I deal? You know, it's chronic. I have to live with it. And then now for me as a Christian also, I was like, but God, what's the point of this pain?
Yeah.
Like, okay, how can I still count it all joy?
Yeah.
You know, so I also went into that lamenting. I'm like, God, I love the book of Job. I love think about pain and what it means. And of course it made me think about, okay, this is a really broken world.
Yeah.
And for me, it also made me think about death a lot. Because when I was in very bad pain, I'd be like, God, I'd rather die. I know where I'm going. I actually believe this stuff. I believe in life after death.
Yeah.
I'm like, I'd rather be dead.
Yeah.
Because it gets so bad. And you'd know it would pass. But in that moment, you feel like you're really dying.
Yeah.
Yeah, so it really made me think about death. I remember when I was going for my surgery, I actually told my mom, you know what, I could die in this surgery. Because it's quite complicated, I was told by the surgeon.
Yeah.
But it's not the worst thing that could happen. Yeah, I told my mom, I'm ready. But of course, I'm also fighting. That's why I'm going for the surgery.
Yes.
But it made me think about mortality and appreciate life also.
Yeah.
Like when you're alive, you want to make the most of when you're feeling very well.
Yeah.
Because you know you'll be forced to stay anytime to stay put when you don't want.
Yeah.
Yeah.
I'm guessing you're on medication as well.
Yes, I am on a hormone because it's a chronic disease. It's estrogen dependent as well. So as long as you're a young woman, you have estrogen.
Yes.
It will keep coming. So I'm on a hormone that suppresses the endo.
The endo.
Yes, I had surgery, but yes, it is.
Has the pain reduced after the surgery?
Yes, it has.
I actually want to first understand the surgery, the workarounds the surgery, because if it's in the uterine where they're taking out the fallopian tubes, you know, kind of like, can you explain at the point of surgery, what are doctors looking for? What are they trying to relieve? Are they removing the blood? Are they, how are they stopping the blood from entering your pelvis? Or are they not? They're just like, man, that's your thing. Please explain the surgery side of things.
Okay, so for the first surgery I had, which was diagnostic, it was just to look inside and see what was up. And when they did look, yes, they were able to see it was endometriosis, because I had the chocolate cyst I talked about. Those were the obvious signs. Ideally, they should actually take out some tissue and do a biopsy. But that didn't happen. I told the guy, just don't take out anything, just see what's in. But there was a lot of blood in my pelvic cavity. So what he did that time was wash it out. And then he actually showed me what a healthy pelvis looks like and what's mine. Yes, so that kind of gave me an idea, yeah? So the second surgery what happens was, first remember I said my organs were attached, so they want to
Detach
separate
them.
yes, then take out the cysts as well, those, okay, no, take them out, and then also, I had fibroids as well, by the way. So
Yes, they are the fibroids, yes.
So I just...
Had they grown by this point? Because when they started, they were small.
They were small, they had grown, but then they had also shrunk at one point. Because I started medication when I was diagnosed.
Okay.
But then the surgeon who, the first surgeon I got was like, I'm not touching you, it's a bit complicated. Then I had to find someone who was willing to touch the endo, then they would remove the fibroids. At first I'd agreed, okay, let me first remove the fibroids. But when I went back, did a scan, I was like, your fibroids have shrunk. You're refusing to have a child. So, and because you said me have a child, I was like, well, I'm not married. I was like, I don't care, I just have a child. I'm like, well, that's not a solution. It's not happening. So I told me, okay, stay on the medication. But getting pregnant will slow down the endo. It will slow down the endo because it's hormonal.
When you get pregnant, people used to have really painful periods. Somehow,
because the estrogen is suppressed when you're pregnant. Yes, estrogen suppressed when you're pregnant.
The hormone is dependent and endo is dependent on estrogen. Okay.
So, so when he said he wouldn't touch me, but then he used to advise that there was no point having the surgery on to remove the fibroids then, because they had shrunk. The hormone I was on for endo had shrunk the fibroids.
Okay. So now you get to the second surgeon and he's willing?
Yes, so I went and saw a surgeon in Nairobi and he was willing, so I also had to do an MRI to see the location of the endo. So there was the scan you're talking about, the transvaginal ultrasound, was one way he could have entered. So he wanted to see the location of the endo before he actually does the surgery. So he's like, okay, you're not sexually active, there's no point putting you through this. It was now like the psychology bit of it. And it's like, let's do the MRI. So the MRI showed that, so some people say that it can't be read, but those who know the disease can read the endo on it. So it's hard to catch on scan, but those who know it, who have been trained and are looking for it, can read it. So then he saw where it was, so around the bladder and also towards the rectum. So when the surgery actually happened, it was to remove the fibroids, deattach the organs, separate them, and also the cysts. So the fallopian tubes, in the MRI, they looked fine, but by the time I went back, they had actually gotten damaged. So that's why he took them out. So not everyone's surgery is going to look the same. It's about the extent of the damage. So for me, that was it. So they removed the fallopian tubes because they were actually really damaged, and of course they could spread the disease further. Then for the cysts, they removed as well. The ovaries, the chocolate cysts, The ovaries, they preserved, they're okay. Because the cysts go around the ovaries. But there's a way they do it and they don't have to preserve. So someone who knows their stuff will preserve as much
as
of
they
your
can.
organs as they can.
Going into the operation, as you say, your fallopian tubes did not look like they had a problem. What did it feel like when you woke up and you were told that your fallopian tubes had to be removed?
No, it had actually been discussed earlier.
That it could be a possibility.
My surgeon was very thorough. And I asked questions, he answered. I came back, so I first saw him. I did a bit of online consultation during COVID, since 2021. And then he said, you know what? Yes, I sent him a video. So with the guy who had diagnosed me here, it's called Dr. Zele. That was his teacher at Aga Khan in Nairobi. So we did back and forth. And it's like, this is what it is. It's deep infiltrating endo. It's stage 4. I actually think you also have adenomyosis, but there's only one way to find out. So, but we need one physical consult. So when adenomyosis.
You will become a pro in these things when you have these conditions.
It's
she's
really
going around the terms like she's a
difference.
and she's like, we should all know.
So let me just explain. You know how some fibroids are intramural, that they happen
Inside
in the wall of your uterus.
Yes.
So what happens with adenomyosis? You bleed within the wall of your uterus as well. So it's different from endo. Presenting your bleeding, but the location is now within the wall. There's within the wall and then there's outside.
Outside is endo.
Outside is endo.
Then within endo is
adenomyosis.
Meiosis. Got it.
So they usually go together.
Yeah.
It's very likely that if you have endo at maybe a later stage, you probably have adeno. Probably not always, but But also it's hard to catch because now it's even intramural.
Yes.
So when I saw him in 2021, a physical consultation. That's when I did the MRI.
Yeah.
And then I'd planned to do the surgery in January. First of all, I didn't have the money for it.
Yeah.
So I had to fundraise. I had fundraised actually even the first time, but from a smaller group of people. My friends, girls I went to school with.
Yeah.
And then now when I needed more money, so I came and ready, you know, to fundraise, and then I just had a setback. We lost a friend in December, and I was like, am I ready to die?
Yeah.
You know, when you're in pain, you feel like I can go now, I'm
Yes.
tired. I was like, okay, am I ready to die? She died so suddenly, and it was a bit scary. I was like, oh my gosh. Anyhow, so I put it off. It kind of put me back mentally.
Yeah.
I was not ready. I was like, if I put word out and I'm looking for money, people will give me money.
Yeah.
That I was not. I knew God was going to provide and He uses people, but I was just not ready to talk to everybody. You know, people of course reach out. So I needed to be also in a healthy place mentally.
mind,
if you're going to put your word out there.
Yeah.
So when I did eventually fundraise and went towards, I think you probably saw my flyer. Some of you send me money. Thank you. Anyhow, but I did. I eventually.
Some of you, you know yourself.
But I did.
People know those things.
I did get a lot of support, honestly. So I did get the money, but by the time I fundraised, I had, I was, one of the things I was praying to God, I need to be mentally ready.
Yeah.
You know, to receive those calls from people asking, what's up, how can we support you? You know, people will ask, and it's
And they
okay,
mean
they're trying to
well.
support you, but it's about how much you can take. So by the time that happened, I was ready mentally. I was ready mentally. So when I went back, we still had that discussion. You know what? If we find that it's progressed, if a fallopian tube is damaged, I take it out if it's one. If they're both, so we had really gone through all of that.
Yeah.
And for me, I was like, take out whatever you need to take out.
Yeah.
The pain just needs to stop.
Yeah.
He was like, I'm going to preserve as much as I can. You can, like, he's one of the most compassionate doctors I know, but also very thorough.
Yeah.
And he's not afraid of questions. You know how sometimes when you ask a lot, people feel like,
you're not
the doctor. I am the doctor. I'm like, but I'm the patient. Exactly. And I need to know. So that's one of the things I'm grateful for is he really took my questions. Even when I was in Kampala, I would send questions. Like, what method are you going to use? What? And he'd really actually answer them. It was really about being clever. It was, you read, then you ask to
questions.
understand. So that had been discussed, whether if they found them, whether they would take them out. So I was not surprised.
Can I ask the big question? Okay, based on biology. Is it possible? Okay, now I'm already saying we can have a baby if we can get this egg and then make it somewhere else and put it in the uterus, right?
Oh, so that's why they kept the ovaries in. Because I was also going to ask that. Like without the fallopian.
So what the fallopian tube does, it transports the egg from the ovary to the uterus. So that transports, the tube is out now. So the only way, it has to be assisted, so that would be IVF.
But I'm curious as to how
pregnant.
that makes you feel, because I know, yes, IVF is like an intervention, but like knowing that your fallopian tubes have been taken out and you're not going to be able to conceive naturally. How did that make you feel? How do you feel about children?
Because you look like you could make a good mom, but you need to be a mom.
How do I feel about children? I love children, but I've never really particularly dreamt of being a mother in that sense.
Okay.
So, I mean, I'm not married, first of all. So, and I've always envisioned my life going either way, married or unmarried. I'm good. I could get married tomorrow if I met the person I was convinced and the feeling was mutual. But also, I'm not, I don't know. So for me, honestly, for me, pain was the biggest issue, and I know fertility is a thing, a real thing, and even while you see doctors, I tell you get pregnant, and I'm like, but fertility is not always that thing, and I understand, because I'm older, and people are like, you'll change your mind, maybe, and I'm like, maybe I'll change my mind, but as far as now, I'm okay with it, I'm okay with it. I'm honestly not sure if I would want to have IVF. The reason is simple for me, I just feel like my body has had enough trauma, but I don't know. But at least that option is there, so we'll see.
So we'll see.
Yeah, but I'm also older, that's the truth. I'm 37, so that's what they call subfertility. The older you are, the quality of your eggs and all.
But you have the right aura around.
Yeah.
It's not like,
yes, she's very
so
positive.
So the solution is there for sure, but I'm good. I'm alive. I'm like,
That's what counts.
how about we just start there and get the support? A lot of people don't. People don't even know what's going on. I think about like the woman in the village who's married actually and has children, and she has to look after this family. She doesn't know how to to deal with this issue. It's just pain, and I don't know what's going on there. So no, I don't have the worst of it.
Yeah, that's all she does. So what are some of the misconceptions? And I think off camera we had sort of talked about the misconceptions about this condition and what happens if endo goes untreated. If somebody never ever finds out and their organs are touching and there's blood in, it's crazy. Yeah.
I think one of the biggest issues is to think that period pain is normal. And if I'd known as a teenager, if first of all periods were talked about like it's a normal thing, that would be a good starting point. But there's this hush about periods that even when you're in an only girls' school, you don't want to just be, you don't want the whole world to know you're on your period. But why? It's a very normal process.
Normal process, yes.
So the period pain being normalized is a problem. I think that should first of all be dealt with. Because it gets worse with time, and I mean people want to have families, and once that comes in the way, it's just not fair. Then the other thing is people thinking that getting pregnant is a solution. It does slow the progress of the disease. First of all, having endo does not equate to infertility.
All the time.
No. There are people who have children with endometriosis. Because remember, it's about the stage of the disease, the location of the disease, you know? But pregnancy does slow the progress of the disease. Remember, we said it's about hormones. So it's not a solution. You just treat a symptom. It's better to know what exactly is going up, and then you treat that. And then the other thing is having a hysterectomy, having your uterus removed. I remember when I first knew that I had endo, my first instinct was like, take out this uterus if it's the cause of your problems. But then when you learn that it's actually happening outside the uterus, there's no point.
Doesn't make sense.
You know, you'll have it removed, but you're going to still, because you're going to still bleed outside, because those cells are already outside your
body,
your uterus. So you're still going to bleed. You'll still be on medication that you're thinking you are going to avoid either way. And then, of course, they will tell you that the way the body works, those hormones help us for balance and bone density and I don't know what. So they prevent also things for you. So that's how God made the body. So a hysterectomy is not a solution. So of course, you'll hear women who say they have had them and for them life is much better. So I think maybe it's about how damaged it was or wherever. But no, it's not the solution to the disease. And then maybe what's the other thing? I've had people in the group, some on a support group, or people who are suffering from endo, who live with endometriosis. And one of the girls said that the first time she had really bad period pain and was admitted, her family thought she had had an abortion. You know, I'd never heard of that. So I thought it was very, very unfair, you know. So some people will link it to maybe you've been on pills and now you're paying, you know what. So not true. You know, so whether you've been sexually active or not sexually active, and it will happen. It's really a disease of the hormones. You know, it's estrogen dependent and it's chronic. It has nothing to do with your lifestyle. Your lifestyle may aggravate the disease.
For sure.
But it's not dependent on that.
Please. Are you done though with the misconception?
What could be the others? I don't know.
I have one more question because I feel like we are in like this deep dark hole. Like, is there hope?
What's the ray of hope?
Yeah, what's the ray of hope? Like somebody is going to find out they have stage 1 because people are going to go and see a doctor and say check for endometriosis because I'm in pain. So they're going to find out there's stage 1, stage 2. I don't know where they're going to find themselves. But is there a ray of hope? Like, does the bleeding ever stop? Does the pain ever stop? Does, you know, like what are the treatment options?
There is definitely hope. First of all, the fact that we're talking about it is good enough. That's a very good starting point. I think awareness is one of the biggest things. The more it's out there, we know about diabetes, we know about HIV. In fact, the way they did the HIV campaign, which is how they talk about endo as well, you know? Because it's happening to girls who are 13, 12, and girls are starting their periods early, you know, as early as 8, you know, 9. So what happens to that girl if she can't talk about her period? So I think there is hope. The fact that we can sit here and talk about periods is a good starting point. The fact that we can say pain is not normal. You have, you know, constant pain that debilitates you, that keeps you away from school, that keeps you away from work. That's not normal. You know, but you can't just take a simple painkiller and move on with your life. That's not normal. So there is hope there. So the more we talk about it, the better. Then, I mean, there are treatment options. Like you say, there are different stages. I was at seemingly the worst stage. I'll call it seemingly because, again, it presents different. And again, pain, one thing I should say is that the level of pain does not necessarily mean, does not correlate with the stage. Some people are symptomatic. You could have no pain, but you're on stage 4.
Oh God.
Wow. You could have stage 2 and you have very bad pain. We all know that pain is like a nervous system thing. So for me, I was in stage 4, but I had really bad pain. So this year was actually particularly bad. Like I had pain all the time, you know, finding a position to sleep on your period. Before the surgery, I remember my last period, I had to stay horizontal for 2 straight days of my first. I couldn't sit up. I felt like I was drowning in something. Like in my head, of course, I was like, oh, is this blood? What's happening? Blood moved up towards my diaphragm. But I'm feeling so much better now. Already, just 2 months post-surgery. So there's definitely hope. This is stage 4, but if you get the right doctor to do it right, I think it's important that you get the right doctor. Because when you don't have the right, okay, so not everyone has to have surgery. So the earlier the intervention, the better. So for me at stage 4, my intervention had to be surgery, but I also got the correct surgeon, you know. I think he did a wonderful job because I'm not in pain all the time now. And even the periods I've had so far for the last 2 months, they've been manageable. I've been taking Panadol, which I don't believe.
I know.
Panadol and
you are okay.
You're okay. You know, I'll still feel weak from anemia, but I'm okay. Like I'm not in that, I'm not doubled over. Before I used to joke with a friend of mine, first of all, you have that bloated tummy. I used to have that bloated tummy. You look like you're 4 months pregnant, and then you can't move upright, you know, you're bent over, you know, that position. So I've been okay. So already I can tell the difference. I hope it gets better with time.
I pray it does.
But also the better, your surgery, the surgery you should have should be probably your last surgery. So, but you hear people talking about having had 5, 10 surgeries. And for me, the only way I can explain that is because they're not doing the job right at the beginning. They're not doing it right. So I advise people to educate themselves. Being your own advocate is so key. Because doctors will tell you something, because some don't know how to say I don't know. Guys don't know how to say I don't know. And also the reality is kind of their money is dependent on
treating you. So
if you have a bad surgery, because remember with every surgery you have scarring, whether it's cesarean or whatever. And scars are not good for anyone with endo. Inflammation, they cause inflammation with time. So if you're not doing it right, you're more likely to have, even I who have had, I think, a really good surgery, there's a chance I could have another surgery. I hope not. But the more thorough and well done the surgery is, the less likelihood of another. And there are actually 2 types of surgery. Maybe just talk about, I'm not a technical person, but I know there's what they call ablation, where they just like burn the surface. It's popular even in the West, but doesn't deal with the issue. So it's like you're burning the surface, I think they call it slash and burn, a term they use, slash and burn, but the root is still there. So exactly, much easier.
Possibility of a reoccurrence.
Very high chance, like 70% chance of a reoccurrence. So you have relief maybe like for 2 years, and it will come back probably even worse. So the ideal surgery would be excision for the person who they've prescribed surgery. And excision is like uprooting. You actually cut it out. You know. And not many people are that skilled. And of course people will tell you, for me I was referred to a lot of doctors, but I was very hesitant. I was very hesitant because I'd read a bit
about it.
And I was, you know what, if I'm going to have surgery, let me try and aim for the best that I think to my limited understanding
that you can get. I think that's the importance of educating yourself, because then when you hear what the doctor says, you're able to kind of refer and say like, oh yeah, that makes sense. Oh, I read that
and
somewhere.
Ask the right questions.
And how was the post-op treatment?
It was actually quite easy and light. I was just given painkillers. I think it's like having a child. So I was given painkillers and for 5 days. And what they always give you when you've had surgery? Antibacterial to prevent an infection.
To prevent an infection.
So it was just that, and I was told to. I also had actually bladder endometriosis. That's I forgot to mention that. I had a nodule in my bladder, so they actually had to bring in a urologist, cut out they took out the nodule and then repair the bladder. So I was discharged. I was only in hospital 3 nights, but only 2 nights post surgery. The night before my surgery, 2 nights after. And when I was discharged with a catheter in.
Oh.
So I went home with a catheter with my friends in Nairobi, but for 10 days to give the bladder time to repair.
To heal,
yeah.
For 10 days?
For 10 days. So I had it a bit longer than normal. It wasn't too bad.
That's a lot.
Yeah.
It's a lot,
Well, it's a lot when you have it in, but I mean, when I think about it, I'm like, no, it could be worse.
Could be worse.
It really could be worse. So 10 days, I'm like, I was just grateful. Yeah.
Thank you, Sheila, for giving us hope. First and foremost, I know we started off and I was just like, oh my gosh, this is so sad. This is really, really sad. But we appreciate you for sharing your story and being a champion for those who are
and I was
dealing.
also actually just going to add, can I cut you short?
Yes, no, it's okay.
Then there's another thing that when I was diagnosed the first time, I actually asked my doctor, do you know any other people who have endo? I need to talk to someone who actually understands the disease. So I said, you know what, let me look for you. Let me look for a society or anybody I know. And then he pointed me to the Endometriosis Foundation Uganda, which I need to talk about. It was started by a lady called Grace Nago, who also was diagnosed with stage 4 endo. But it just helped. So I called her up. I think I first sent an email and then she replied and then we met up. But just talking to somebody who understands, who has been there, is very, very helpful. So we have a support group. I think I'd mentioned that. So it helps to be in a group like that, to just talk about different issues. What works for you? What are you doing right? Nutrition, I don't know what. So that's very, so there's definitely hope. And there are also doctors who are really quite keen now on understanding endo, and doing the work, putting in the work, educating themselves and talking about it also. I think we've seen it a little more around now, but about it more. So there's definitely hope.
So thank you so much, Sheila, for sharing your story. If you are out there, you're watching, and some of the things that have been described are similar to what you're dealing with, yes, you might want to see a doctor and get a proper diagnosis, but in terms of receiving hope and support, there is a support group that Sheila has just alluded to. Please do call the number in our description box and find a community of people who are dealing with this condition and can offer you some support and hope. And that's all we had for you. If you would like to share a comment or two, a message of encouragement to Sheila and to anyone else who's dealing with endometriosis, do let us know in our comment section. Until next time, with love from Bump Love.